only one where you have to think about stuff on one side of the body to the other side of the body. Okay? When we walk, like a big X that happens at our low back, transitioning essentially the function of this hip to the opposing shoulder so that we're counterbalanced. And if I had just the superficial layers here to show you where this was mirrored over, look at the fiber directions of gluteus maximus, how they meet the lumbar dorsal fascia, then they come over onto latissimus dorsi all the way up to the shoulder. So it's literally one cool big X. It happens right there at SI joint / the lumbar dorsal fascia. I mean, there's a reason why this is the most dysfunctional area we have. There's a lot of postural components plus this bridge of movement that has to occur. So in the books, it's going to say gluteus maximus, that should be the dominant mover. And in general for low back dysfunction, core dysfunction, it's glutes and obliques. They together should be what helps support your body relative to your pelvis. So there's the postural piece of that, of kind of like getting yourself set, tucking the core in, unlocking the knees, and using your glutes. So between your glutes and your obliques, that can be supporting your torso, not the muscles up and down your spine. Those should just kind of be, give them a little less to worry about. Now, the way this works though, is it's these glutes, these high hamstrings, because the hamstrings function at the hip as well. So gluteus maximus and the high superior or proximal hamstrings, they work together, and it's okay if they co-contract. All right, that'll happen a lot for you. You try to palpate between these two and see which one's firing right. And a lot of people are high hamstring dominant. Where appropriate glute function becomes more and more important is depending on stride length and activity level. If somebody's trying to become more athletic and going into a running-based mechanic, you really need your glutes to be firing more effectively. If you're pretty much just a walking human, it's okay. You'll be fine if these are co-contracting, all right? It's this that is the problem. Opposite side, contralateral, lumbar erector spinae. The sequence should be for the most perfect athletic human, gluteus maximus, same side, high hamstrings, proximal hamstrings, contralateral, opposite side, lumbar erector spinae. So I have to palpate one side of the body together. To start with, all we have to really worry about are glutes versus erector spinae. I tell you, don't worry too much here. Get really good at identifying this. If the low back is firing before the glutes, the low back is having a bad time. And then we have to try to find a way to change that. So I'm on the right lumbar erector spinae, left glute. And again, with these palpations, don't be overly delicate. You're not going to feel it if you just do this. You got a dent. All right, now the action here doesn't have to be huge, but what does have to happen is the whole leg has to move, the femur. A person can trick you with just extending their knee and just flatten your knee, but keep your foot on the bolster. We'll do that. We want the whole leg to come up. And it doesn't have to be huge, but I usually have to like show a person, like just lift your whole leg. There we go, that's perfect. Doesn't have to be bigger than that, but they have to clear the table and the bolster, otherwise they could be cheating. All right, little lift, and back down. Real slow again. Okay, was low back, kind of subtle, when it was low back. She's got a bit of a twist too. Okay. And then right leg. That that glute kicked on first. Okay, again, nice and slow. Yeah. So right glute's doing a better job. I'm trying to remember which side low back was more ornery. Was that this one?
Yep.
Yeah. So the story continues to make sense. And this is a big one where just rock, put my palm right on the sacrum, just try to get everything rolling back and forth, seeing how things are moving, palpation, palpation. The tone on the left erector spinae actually is more, and the twist seems to be such that it's like a right rotation. And that's stuff for another day. But the way to interface with this is just compression on the erector spinae. Now I could do it this way, but in order to have something more to teach, I want to show some options of how to get more effective pressure on those erector spinae. I had it a little bit there. What's happening though, for me to get this to feel more intense and to be more directly compressing that specific muscle, it's like using our squishy analogy. If I'm only coming at things on an angle like this, as opposed to coming more straight down. And that's where the body mechanics challenge is. Since this is at the middle of the table, I'd be reaching. So most of your forces are going to end up with you kind of having more of an angular direction on these, pushing them that way. And that's not necessarily bad, but it limits you in this position where it feels like it's only going in those directions, as opposed to finding a way to pin them more directly, like that. What that requires is getting yourself real close. That's a big reason why moving the arm out of your way is important. So you can get right up on the table, and I'm going to push straight down. And if the one time where I really feel like pulling a little bit towards you is okay. Now it's not big, but then I get it pulled a little bit away from the spine, as opposed to the pressure being directed towards the spine. And I promise it feels also like a bit more focused on those particular muscles. Because it is, it directly compresses them more directly. Being able to find a way to do it like this is where it feels really effective, because it'll also pull the tissue away from the SI joint.
Great.
I don't think you have too big of a spill.
No.
I don't think so.
So this is one of my things that clients just love. And it was me figuring out how to get that direct pressure, but using this arm going this way. When you first learned these applications, I was telling you to use this arm predominantly, right? Because it keeps you away from hitting those floating ribs. But even here now, you should be able to be at a point where you can avoid those and work on the mid-thoracic area without it being a problem. Like, we're past that now. So it's using this arm here and starting real close as I can get to that SI joint. And then I try to keep my compression real straight down with a little bit pulling back toward me. And looking at the clothing, you should see how it pulls that tissue away from the spine. And then if I just kind of let my arm also flatten out, going upward towards, away from the pelvis, then I'm also pulling it away from the sacrum. Now, the big thing here is not to turn this into a big glide. Don't do this and then try to turn it into a big thing. This has to be just for this very isolated little area. Everything else can be worked on much better once you're away from it. I can come up here and pull this away from the spine, even the higher segments of the lumbar area. It's just going to be just for this. Here, here, here. And then my arm is here to help tell them which leg to move. So little lift,
inhibit the lower back,
Yep.
lower back from engagement.
Yep, I'm inhibiting right side lumbar erector spinae and encouraging left side glute maximus to activate. Little lift. And good. But this is mostly can be just a static compression. And this also can feel just as good just going over the sheet because then you don't slip, right? And down. Sometimes, frankly, people's underwear are up too high for me to be able to like get to the SI joint. So I've just got out and go, how this the sheet. Or with the shorts, it was a question, do I pull the shorts down or do I actually pull them up a little bit so I can get a more direct pressure on these spots? Okay, again. Let go. Good. Now this one I used a lot in the way I would do it, because people tend to start in prone. Quick thing to assess before got massaging. I would just do the massage in prone, then would put the sheet back over top and say, okay, we're gonna do one more thing. Hey, we're gonna do one more thing for your low back. So I just do the routine, re-drape, find these areas, and over the sheet, so then like their low back got worked on twice. I didn't waste all my time with the lotion aspect of gliding and everything doing this. I did this at the end of prone. Lift. That feels like more of a struggle. Up. Slowly down. Again. Less struggle. Down. And again. And down. And just kind of regular massage. Here with the twist that you'll see in people, right? She was twisted this way. Now, one day we'll get to like looking at the pelvis and all of that. That tends to be more like advanced stuff, but it's tough to initially incorporate. So it's usually a continuing education kind of a thing. I give you a good go-to option on it. But one thing can be, here's the twist. Can I just pin the spine, essentially? Grab the lateral leg, not up at the hip, I'm over here like around the IT band, and I'm just gonna encourage, come this way, other way. Trying to say to the body, be this, but making it feel more like massage. So it just turns into a squish, and then I pull to encourage that rotation in the opposite direction. A little bit above and beyond what we were talking about, but that's what I'm doing to try to help her out of it. And then I do the whole low back jostle and see if it's more lined up. And it is. I like to think I'm not, making myself out with false positives. But the thing is here, that can be a factor. You equalize the tone of the lumbar erector spinae and see what happens. You encourage gluteus maximus on both sides to be more dominant. And it really will always be a good thing to do for people. And it matters more for clients that need the therapeutic change stuff. They want that kind of therapy. The awkwardness here is just getting this orientation. That's where lowering the table, if you have a hydraulic one, or having the step can be beneficial, because me being able to get higher up allows me to come more straight down on this area.